Greetings. My name is Cynthia Peterson. I am the Out-of-Home Care and Youth Program Manager for the Child Welfare Information Gateway and Project Coordinator for the NRC for In-Home Services. On behalf of the NRC for In-Home Services and Friends, we welcome you to today's webinar, Building Support to Serve Families of LGBTQ Youth. Before we get started, I want to go over some housekeeping tips. Just bear with us here. We have a new system. You should see a control panel that looks similar to this, except the phone number will be different. We recently upgraded our webinar system, so you can now listen to us using your computer or your phone. You can select which method you like to use using the audio tab on the control panel. If you select Use Telephone, it will give you a number to dial. Everyone will be muted throughout this call, so you won't need to enter an audio PIN. You can also listen to today's webinar through your computer speakers by using the Use Mic Speakers option. We are expecting over 200 attendees for today's webinar, so you will be we'll be keeping all lines muted throughout the webinar. However, there are a few ways to interact with us today. You can use the questions section to send us any questions you have, or let us know if you're having technical problems. Another way is to let us know you are having technical difficulties is to use the raise your hand feature. That way we will see that you are having technical problems and you will and we can help you. Also want to let you know that we will allow time at the end of each presentation for questions, and at the designated time you can raise your hand and let us know that you want to be recognized, and we will unmute your phone so that you can give your questions verbally to the audience. And then you can also type your questions in the chat box, and someone will respond to your inquiry. If we don't get to your question, don't worry. A question and answer document will be developed and posted on the NRC In-Home website, along with today's PowerPoint presentation and handout. Now back to the webinar. I'm going to go ahead and turn it over to Lisa Diano, who will talk to you a little bit about the National Resource Center for In-Home Services and our partnership with Friends.
Good afternoon. My name is Lisa Diano. I'm the Project Director for the National Resource Center for In-Home Services. We're very happy to be co-hosting this webinar today with the Friends National Resource Center for Community-Based Child Abuse Prevention. My colleague Julie Collins and I will be just talking a moment about the work that we do and why we've come together for this webinar. The NRC for In-Home Services is a relatively new service of the Federal Children's Bureau, and our mission is to promote alternatives to out-of-home placement. I'm going to turn it over to Julie to talk a moment now.
Thanks, Lisa. Welcome, everybody. Just wanted to spend a moment talking about why we're actually doing this webinar. So there definitely has been some research and a lot of information around the needs of the youth that are LGBTQ, and that the services that have been provided to them have not necessarily always met their needs. A lot of the focus in more recent years in terms of the services has really been around the youth as an individual and not so much focus in terms of the context of them within their families, and have tended to really focus more once the youth has left care, have left the home and are in care or are transitioning from care. So part of what we wanted to do on this webinar is give recognition to the importance of really supporting the families before the youth have to actually leave the home, so finding a way to really have increase the supports for the families as well as decrease the risk of potential child abuse and neglect. kind of increase the resiliency for the families and the social-emotional well-being for their children. And we've tried to do it within the context of the folks that are being served by the various resource centers. So a little bit the information is going to span kind of the spectrum of the audience that will be present on this call. I also wanted to say, for those of you who don't have a lot of familiarity with the Friends Resource Center, it really is focused related to supporting the entity in the state that gets the captive Title II dollars, which is all the prevention of child abuse and neglect, kind of primary, secondary, before they leave the home. And you can go to the website and learn more information related to that. We have the website at the link at the end for you to reference. With that, Lisa, I'm just going to turn it back to you so we can get on with having our presenters present.
Great. We're very honored to have 3 presenters with us today. The first presenter is Caitlin Ryan. Caitlin is a clinical social worker who has worked with LGBT health and mental health for more than 35 years. She is the director of the Family Acceptance Project at San Francisco State University, a research, intervention, education, and policy initiative that is developing an evidence-based family intervention model to help ethnically and religiously diverse families support their LGBT children, to reduce risks for suicide, substance abuse, HIV, and other negative outcomes, to promote their well-being, and to strengthen and reconnect families and foster permanency for LGBT children and youth. Her work has been recognized by many groups, including the National Association of Social Workers, the National Association of People with AIDS, and the American Psychological Association. Division 44 gave her a Distinguished Scientific Contribution Award for groundbreaking research on LGBT youth and families. I can just mention that from the NRC in-home services perspective, of course, once a child has come to the attention of the child protection system, there is a requirement that reasonable efforts be made to keep the child in the home. And as we look through the literature from the perspective of in-home services, Caitlin's work stood out among all others. Most of the work is about what happens after a child is in out-of-home care. And Caitlin's work with the Family Acceptance Project was sort of a guidepost for us. It told us that there were ways to work with families even when there is abuse and neglect present, to work around these issues. And so we were very honored, very happy that she's been doing this work for so many years, and very honored to have her as a presenter. Following Caitlin, Ellen James will speak. Ellen is an attorney in private practice specializing in family law. She also serves as regional director for PFLAG National, which is Parents, Families, and Friends of Lesbian and Gays for the central region of the United States, covering Nebraska, Iowa, Kansas, and Missouri. As regional director, Ellen advocates and educates for the LGBT community and their families. She and her husband have 3 school-aged children, one of whom is transgender. And our third presenter will be youth advocate Sixto Cancel. Sixto is a former foster youth who has served as a Jim Casey Young Fellow, which is a group of young people who provide valuable youth input regarding the implementation of Jim Casey Youth Initiative strategies and goals. Sixto currently works with other former foster youth to launch a nonprofit called Rising Tides, which recruits donors to donate toward asset buildings for youth leaving the foster care system. In addition to his work reshaping the child welfare system, Sixto has served for 4 years as Connecticut State Treasurer for the NAACP Youth and College Division, and is on the advisory board for the American Institute's research on lesbian, gay, bisexual, transgender, queer, questioning, and allied youth. And Sixto is currently a freshman at Virginia Commonwealth University. You can see how honored we are to have this wonderful group with us. I should mention Sixto is also a youth advocate for True Colors. I'm going to turn it over to Caitlin now. We've got a really full hour and a half. Our objectives will be to learn about innovative programs that build support for families of LGBTQ youth, to provide tips for best practices for working with families who are parenting an LGBTQ youth, and to provide helpful resources to support the systems that serve this population. And at the end of our presentation, we'll be doing some talk about the resources that we can provide. And I see we're going quickly through those slides, so we're now with Caitlin. And Caitlin, we'll turn it over to you.
Thanks very much. I'm really happy to participate in the webinar. There's a lot to say, so I'm going to move through my presentation at a brisk pace. I want to give you as much information as possible. You'll have an opportunity to review our slides, re-listen to the audio, and also to visit our webpage to download materials and follow up with some of the resources and references I've included in this presentation. So don't worry about getting everything in one session. You can always listen and review the materials again. How do I advance the slides here? Hello?
Click on the arrow button.
The arrow button. Click on the arrow?
Yeah, or you can use it on your keyboard, the arrow on your keyboard.
I was trying it on my keyboard. My keyboard is not advancing. Okay. I think you'll have to advance these slides. I don't know if it came over to me.
Caitlin, if you can go to the bottom left-hand corner of your screen, and you will see, if you mouse over, you will see arrows.
Caitlin is not
on
the
bottom.
presenter. I'm
sorry?
Caitlin is not the presenter.
Okay.
You are, Cynthia.
Okay, thank you.
All right, Cynthia, you're going to have to, we'll do the best we can. I want to start with a few takeaway points first. The Family Acceptance Project is expanding the frame for how we serve LGBT children and adolescents, and it's working on changing the paradigm to serve them in the context of their families. Second, our research has found that family reactions have a compelling impact on their LGBT children's health and mental health. Our intervention approach sees family connections and faith as strengths, and this approach helps families decrease rejecting behaviors that our research has shown are related to increased risk for their LGBT children, and to increase family support, which our research shows is related to decreased risk and well-being. We're also developing a new family intervention model to be used in a wide range of settings, from health settings to custodial care, out-of-home care, schools, to serve LGBT young people in the context of their families. And this approach is grounded in our extensive research and family intervention work that we've done for the last 11 years with highly diverse LGBT youth, children, young adults, and families. Could I have the next slide? Our approach is strengths-based. It meets families where they are. Our aim is to empower families to decrease rejecting behaviors that increase their LGBT children's risk for serious health and mental health problems, and help them increase family support to promote well-being. Our approach with out-of-home youth, we really run the gamut from in-home and prevention to out-of-home to reconnecting, is really to increase family connections and foster permanency. We work across the disciplines and systems of care, and our aim is really to help all of those disciplines and systems understand the critical role of families. Understanding this and really changing our systems will enable us to intervene early to prevent many serious negative health and social outcomes, such as homelessness or removal from the home, to prevent suicide, substance abuse, and sexual health risks, to build self-esteem and wellness, and strengthen families. So using a family-focused approach enables us to work with families at any point before or after disruption or health crises have occurred. Could I have the next slide? Historically and still today, providers across disciplines serve LGBT young people either individually or primarily through peer support. And we've found across the time period that we've worked, and even today, that few services for LGBT youth have included their families. There are many reasons for this, including the perception that families are unsupportive at best and that they won't be able to, particularly families that are socially or religiously conservative, to support their LGBT children. And this perception persists even though social attitudes and media representations of LGBT people have been changing dramatically over the past 40 years. Go ahead, the next slide. These are really the core principles and conceptual shifts in our work. Our approach is based on research and interactions with scores of very diverse families with LGBT young people. So engaging families and helping them learn to support their LGBT children requires a conceptual shift on the part of providers across disciplines and systems. And this includes seeing all families as potential allies for their LGBT children, not adversaries. Understanding that diverse parents and caregivers can learn to support their LGBT children, and that parents and caregivers who are seen as rejecting their LGBT children are motivated by concern to help them fit in, have a good life, and be accepted by others. Could I have the next slide? Since the late 1980s, research has shown that young people, whether they're gay or straight, become aware of attraction on average at about age 10. And key studies in the 1990s showed that lesbian, gay, and bisexual adolescents were self-identifying as lesbian, gay, or bisexual on average between 14 and 16. And in our study of LGBT youth with the Family Acceptance Project, we found that young people were identifying excuse me, as lesbian, gay, or bisexual a little bit over age 13. And their parents were finding out about their identity on average about a year later. We've also found, and we've begun to see this increasingly, that many young people are clear that they were lesbian, gay, or bisexual at much earlier ages, 4 or 5, 7, 9, or 10. And gender nonconforming children, those who don't meet their parents' or cultural expectations about how boys or girls are expected to dress or behave, they understand these differences from very early ages. But what parents and adults often don't realize is that children internalize these messages about being LGBT or gender nonconforming from very young ages from others. And this lets children know how safe it may or may not be to come out or be who they are in the context of their family. And understanding these early ages of identity development and gender expression and self-perceptions, understanding that they're formed much earlier than common perceptions, is extremely important for everyone who works with children, youth, and families. Could I have the next slide? Our project was designed to include multiple components. We've conducted extensive research and are continuing to publish and write about what we've learned. Our project was designed from the very beginning to be both a research and an intervention project, and that includes public education, professional training, developing a new model of family care, and public policy components, since our research is impacting how we serve LGBT young people across diverse systems. Could I have the next slide? Our work started with a study that looked at how, I wonder if we're out of order here with the slides. Could you move to the next slide? I can't see the screen, so. We started with a study that looked at how families react, respond, and adjust when LGBT youth come out or found out or forced out of the closet during adolescence. This is the first study to explore the experiences of family reactions and adjustments for both the adolescent and key family members. And we wanted to understand not only how families respond, but what are their specific reactions to an adolescent's LGBT identity, such as preventing them from having a gay friend to supporting their gender expression, and how these parental and caregiver reactions would affect health, mental health, and well-being in young adulthood. So our study included not only in-home youth and youth in all kinds of family settings and configurations, but also homeless and out-of-home youth and youth in custodial care and their families. Could I have the next slide? We've conducted a great deal of data from several linked studies over the past decade. but I'll just talk about a couple of key studies today and how they've informed our intervention work. We started with an in-depth interview based with LGBT adolescents and families who are out to at least one parent or caregiver. This included the youth, key adults and siblings, other key relatives. Each interview was conducted individually. It looked at early child development, gender expression, LGBT identity development, family constellation, and immigrant experiences if they were an immigrant family, cultural values, religious practices and beliefs related to having an LGBT child, school and peer experiences, the adolescent's identity development process, sources of support, hopes and dreams for the future. We actually collected several thousand pages of individual interviews that were transcribed, translated, and coded, and gave us extensive information on how to help support very diverse families with LGBT children. This research also identified over 106 ways that parents and caregivers expressed acceptance and rejection of their LGBT children. And I think the slide that's up now shows some of these behaviors. These ranged from behaviors such as talking with an adolescent about their LGBT identity, even when they're uncomfortable, standing up for them when they're mistreated by others because of who they are, to behaviors such as not talking about their identity, telling them that how they look, act, or behave, their identity is shameful, trying to change their identity. We measured the relationship between each of these accepting and rejecting behaviors during adolescence with health and well-being as a young adult in a follow-up survey of LGBT young adults. We took the findings back to many of the families in the first part of our study, into other very ethnically and religiously diverse families, as well as LGBT youth and the providers who work with them, to learn how our findings would impact family relationships, adjustments, and interactions. And we did an extensive work with diverse families and others to develop our educational materials and tools, and to inform the development of our interventions. So what's exciting now about having identified and then measured these behaviors is that we can show families, foster parents, caregivers, and others how each of these behaviors is related to their LGBT adolescents' risk and well-being. And this means that we can show families that behaviors they thought were helping their LGBT child, such as trying to change their identity or telling them they're ashamed of them or not letting them have an LGBT friend, how it affects the adolescent's risk for depression, suicidal behavior, substance use, HIV and STDs, as well as self-esteem, sense of the future, life satisfaction, etc., as a young adult. Could I have the next slide? We found that dose, or the amount of accepting and rejecting behaviors, matters. In other words, a lot of these rejecting behaviors or accepting behaviors are related to greater likelihood of health problems or well-being as a young adult. So in this slide, what we're actually seeing is that LGBT adolescents who experienced a lot of family rejection during adolescence as young adults are more than 3 times as likely to use illegal drugs. And this risk is cut in half in terms of adolescents from families with moderate levels of rejection when you compare it with those young people from families with no or low levels of rejection during adolescence. Can we have the next slide? We saw a similar relationship really in everything that we measured. And what you're seeing here is that the relationship between high levels of rejection and risk for HIV infection as a young adult. So you're seeing a more than 3 times greater likelihood of risk for HIV through unprotected sexual intercourse. And again, this risk is cut in half with moderate levels of rejection during adolescence. The next slide. This relationship is especially compelling with suicidal behavior and attempts. We found that LGBT young people with high levels of family rejection during adolescence are more than 8 times as likely to try to take their own lives 1 or more times. And this risk is dramatically lower in LGBT young people from families with moderate levels of rejection. We found that some family-rejecting behaviors are highly predictive of suicidal and other kinds of risk behaviors. And we've written about this in our family education materials, and we show this and other relationships in our assessment screening tools. For example, we found that preventing an LGBT youth from having a gay or transgender friend has the same level of risk for suicide as physically beating them because of their LGBT identity. These findings are very important for diverse families who lack accurate information about sexual orientation and gender identity, and who think that being gay or transgender is the result of having a gay friend or learning about LGBT people or reading about it. And these misconceptions are very common even among families with advanced educational levels. Next slide. We found that family acceptance is protective against suicidal behavior, depression, and substance abuse. High levels of family acceptance, again, those accepting behaviors during adolescence, are actually related to much better overall health, high levels of self-esteem, and much greater social support. We found that a little change in parental and caregiver reactions, being a little less rejecting and a little more supportive, can make a difference in their adolescents' health and well-being, and this is an important message in our intervention approach. Next slide. We found that parents and caregivers' attempts to pressure their children to conform with expectations about what's appropriate gender behavior to be more or less masculine or feminine was also related to health and well-being as a young adult. So high levels of pressure to conform were related to much higher levels of health problems compared with peers from families with no or low levels of parental pressure to conform. And alternatively, we found that supporting your child's gender expression is one of the most important ways that parents can help promote their children's well-being as a young adult. Next slide. We found that young people's perception that they could have a good life as a young LGBT young adult is related to family acceptance. This is very important since having a sense of the future is related to many other aspects of care, such as health promotion and self-care, and certainly academic achievement and planning for the future. Next slide. So our research has shown for the first time that family rejection is linked with serious health and mental health problems for LGBT young people, and that family acceptance is both protective against risk and helps promote well-being for LGBT young people. We work with families from virtually every background, with families from very diverse faith backgrounds, and we've also worked with religious institutions, including those that are seen as being very conservative. And our work includes meeting with religious leaders, doing training on our findings and approach to supporting LGBT young people and families for clergy and congregations. We've started to develop specific family education materials for families from main level faith traditions to help them learn how to support their LGBT children in the context of their religious values and beliefs. Our approach meets families where they are. It sees faith as a strength. So families who feel that they can't accept their child as gay or transgender can still support that youth or young adult by decreasing those rejecting behaviors that are related to high levels of risk, including suicide and HIV. And clearly, decreasing family rejecting behaviors decreases family conflict and helps increase family connections. Next slide. We've been developing a series of family education materials in 3 languages, English, Spanish, and Chinese, again with guidance from ethnically and religiously diverse families. We're raising funds to complete our family video series. This helps families understand the process that other families from their ethnic, cultural, or religious backgrounds go through to support their LGBT children. We've been developing policy guidelines and assessment tools. We consult on many legal cases, on school environment, and on developing family intervention programs. We do training in a wide range of settings. We have a lot more research to publish and many materials and tools to help communicate our findings to diverse audiences. And we're continuing to work on developing our new family model of wellness and prevention and care based on our research and family approach. Next slide. As I mentioned, our basic family education booklets are available in English, Spanish, and Chinese. These booklets, Supportive Families, Healthy Children, have been designated as the first best practice resources for suicide prevention for LGBT people. And that's from the National Best Practices Registry for Suicide Prevention, which is a peer-reviewed compendium of best practices from the Suicide Prevention Resource and the American Foundation for Suicide Prevention. You can download individual copies of these booklets from our webpage. We also disseminate them all over the U.S. and anywhere, really, in orders of any size. These tools are really intervention tools, and they're part of our family intervention approach. We use them to educate and help families modify rejecting behaviors, to decrease conflict and risk, and to help them learn supportive behaviors and more supportive communication to increase the adolescent's well-being and also family connectedness. We raise the funds to develop lower literacy versions, and we have two versions forthcoming, one at a 5th grade and another at 3rd grade reading levels. And as I mentioned, we're developing specific versions for families from faith traditions. And next month we'll release the first version for families from one of the major religious groups to help families how to support their LGBT child in the context of faith and religious beliefs. Next slide. So, as I mentioned, we developed these tools with guidance from very diverse families, LGBT youth, and the providers who serve them, and they really told us what the messaging should be, how to frame it, how to present it, what it should include. So these booklets include some of the graphics from this presentation, family stories that show how families and caregivers support LGBT young people, and lists of family accepting and rejecting behaviors that our research shows are related to risk and well-being for LGBT young people. The multicultural versions are actually cultural translations that communicate these concepts and findings from specific cultural perspectives. And we developed them to be used by readers not only in the U.S. but from all kinds of countries of origin where these languages are spoken. Next slide. We've also been developing a series of short broadcast quality family intervention videos that again show the process, show the journey in this case of ethnically and religiously diverse families from struggle to support of their LGBT children. And again, these are intervention tools. They show accepting and rejecting behaviors and major concepts that we've identified in our research that are related to increasing support for families. Next slide, or just keep it on this slide right here. We'll disseminate one of these videos, Always My Son, with Spanish and English subtitles, as soon as we complete the discussion guide. These are used really in a variety of ways, with individual families, in conjunction with the booklets, in direct clinical work, for provider training, and to help extended families and communities understand the lives and experiences, to humanize those lives and experiences of diverse LGBT young people and families. Having research to guide and support behavioral change is a critical aspect of helping families understand that their reactions to the adolescent's LGBT identity or gender expression affects their health and well-being. And again, this is especially important since many families believe and are told by others that trying to change, punish, or shame that LGBT youth will help their children fit in, lead a good life, and be accepted by others. So I don't have an overall schema, but what we're doing is creating a series of tools and resources that move the process forward. This is our FAPrisk assessment screener that enables providers to quickly identify levels of family rejection and related health and mental health problems, to intervene to prevent negative outcomes such as suicide and homelessness. It can be used by child welfare and juvenile justice diversion teams to help decrease family conflict and prevent removal from the home and maintain family connectedness. It identifies specific family rejection patterns that contribute to serious health problems as well as family conflict and ejection or removal from the home. And it's really a great way to start the discourse and the dialogue. We do training on using the screener, and we're now looking for funding to develop an online CME CEU course so providers can learn how to use it in all kinds of settings. Our intervention approach has multiple components, including the whole process of community engagement with providers and communities to help them understand that families are allies, not adversaries. Family education is a core component with all families, as well as counseling and culturally congruent peer support. Next slide. Our approach aims to educate and empower families so they can make informed decisions for their children and families. As I mentioned, most families have very limited information and typically misinformation about sexual orientation and gender identity, especially in adolescence. So this is really very important in helping families understand what's really happening with their children. Next slide. Timing is actually a critical aspect in work with families with LGBT children and really in any kind of intervention work. But in terms of these issues, not only is each family different, but providers who work with them need to balance the adolescent's needs with ongoing family dynamics, as well as literacy issues, educational level, and cultural considerations in intervening and creating an alliance and helping that family understand what's happening with the adolescent and how to help them increase support. Next slide. There are a couple of key messages for families that will help you think about how to approach and work with them. One is that a little change in how families respond can make a difference in the LGBT young person's health and well-being, and also in the level of family conflict. And the other is that families' words, actions, and behaviors have an emotional and physical impact on their LGBT children. And for many families that we've worked with, this is the first time they've ever even thought of these issues. First, because our research is so new and no one has ever empirically unpacked acceptance and rejection, but just because this is coming from a very different perspective. Next slide. An important part of family intervention work is helping connect families and caregivers with others from their cultural experiences and faith backgrounds. Parents, foster parents, caregivers need support from other families who can help them learn to interact positively with their LGBT children. And even basic communication in languages where they never really had positive ways of communicating these issues. Next slide. We disseminate our materials and resources across the U.S. and groups in other countries. We do on-site training not only to engage communities, but to implement our family support approach in local agencies and jurisdictions, and that includes consultation on helping think about these issues and integrate services and activities into programs that really didn't involve families in the past. Next slide. Our work with the Family Acceptance Project is having an important impact on how we think about and serve LGBT young people and children and adolescents. Actually, the Center for American Progress has said that our work is generating a revolution in public policy for LGBT children and youth. Next slide. If we think about this, for more than a decade, in our project, we've been pressing to engage and involve families in their children's lives and care, but so much of the approach has been on either serving youth individually or through peer support. This frame, the kinds of research and findings that we're generating, it's creating a shift not just from protecting LGBT young people from harm, which has been primarily the focus, but how do we promote wellness and positive well-being, especially in the context of their families and communities. This approach is relevant for all families with LGBT children and adolescents. We've found that it's not just really for families that are seen as rejecting, that many families who think they're accepting are actually ambivalent and lack accurate information about having an LGBT child or adolescent. So they may think they've accepted their child, but still don't engage in basic behaviors like talking about the adolescent's identity or many of the other supportive behaviors we've measured. There are many ways that we need to start expanding the frame to ask LGBT young people about their families, because providers still don't do the basics of asking about sexual orientation and gender identity, to engage, educate, and inform families about how to help support their LGBT children, and to start to introduce family components into all existing programs and systems of care. Next slide. We've helped many families, jurisdictions, programs, providers to think about new ways to engage and involve families in their adolescents' lives or child's lives, and to introduce new evidence-based family approaches to decrease risk and promote well-being. We try to get our materials up on the web page as fast as we can, but we're at a state university, and that's pretty challenging these days. But stay tuned. Keep coming back. We'll get them up as fast as we can, and thanks so much for this opportunity.
Thank you so much, Caitlin. We want to take this opportunity to open up the floor for questions. Like I talked about before, there are 2 ways that you can ask a question. You can raise your hand, and once you raise your hand, you'll receive a code to unmute your phone, and that way you can ask your question verbally to the audience, or you can type in your question in the chat box, and we will go ahead and read it aloud to the audience. So this is the opportunity that if you have a question for Caitlin or a question about the Family Acceptance Project, here's your opportunity. Okay, I do have a question, and the first question is, does the Family Acceptance Project have a Facebook to follow?
A Facebook page?
Yes.
We don't have a Facebook page right now because we're really short-staffed, and we have so many tools and materials that we need to develop that we don't have dedicated staff to put on Facebook. But we have great media support in the community, and they tweet various things that we're doing and put us up on their Facebook pages and help get us out to lots of other community groups. So at this point, our web page is our primary dissemination mechanism apart from hands-on training. We do a lot of conferences. In the past 5 years, we've trained about 30,000 providers, families, young people across the U.S. and in several other countries.
Okay, great. And our second question comes in, and that is someone is wanting to know how they can request the training assessment.
Just go to our email address is on the last slide. You can send us an email, and we can follow up with you to talk about what you need and how to go about scheduling that. We're going through a big media dissemination now because our best practices designation for suicide prevention has just come out, so we're getting more than our usual 200 requests a week. We're just getting a lot of them, so it may take time to get back to them.
Okay, thank you, Caitlin. And we want to go ahead and it doesn't seem like we have any more questions.
Cynthia, could I just jump in? This is Lisa.
Sure, go ahead.
Yeah, I just wanted to, because I got a little off track when at the beginning. Just to put this in a little, what we're talking about, a little more context for the child welfare in-home services field. As you know, when we look at reasons for placement of children, it's unlikely we're going to see family rejection because of sexual orientation or gender orientation. But Caitlin actually, along with a colleague, did a 2005 study and talked to LGBTQ youth in out-of-home settings and found that 42% who participated in the study said they were either removed or rejected from a home because of conflict related to their LGBT identity. And the reasons for the placement were behavioral disorders, drugs, family violence, abuse and neglect, and chronic truancy. So I just kind of want to emphasize that this, the issue of family rejection may be hidden, and just get Caitlin's comment about that if she can confirm that. It's something that you have to kind of work your way into to understand.
Absolutely, Lisa. Not only is it hidden, very few jurisdictions in terms of following up on a report would ever even ask about these issues. And in fact, we've worked here with child welfare to talk with the response team about what they actually ask about. They never ask about those issues, and I discussed how would we in fact integrate our FAPrisk assessment screener in doing, calls. And so they, they said there's such a profound need for basic education and training about sexual orientation and gender identity. And we've also talked with the child abuse hotline, callers, and we've trained them, and we've talked with them about the need to actually ask about gender expression, because that may not be something that even comes up until you go into the home or you actually engage those people, full on in a full discussion about what's really happening underneath. And I think that what we have got to do across the board is to integrate culturally appropriate questions, culturally relevant questions about kids who might express their gender in a different way or who may be presenting in different kinds of ways, because underlying a lot of the abuse and negative parental reactions are the aspect of that young person being LGBT. And given the fact now that the information barriers that prevented children and adolescents from diverse cultures from learning about who they are, those barriers have really been removed in the media and the popular culture and on the internet. And there's no going back to a time period when people didn't come out until they were adults. Now what we're really going to be seeing is normative development in terms of going through these developmental issues at normative periods during childhood and adolescence. So in our research, one of the things we also do is an ongoing assessment of services for families, especially diverse families with LGBT children and adolescents. We found just a dearth of those kinds of services. So there's a lack of awareness that these things are happening in childhood and adolescence on the part of all disciplines, systems, service-related programs, schools. It's not just related to in or out-home youth or children. It's a whole system that doesn't really understand that these are normative processes in childhood and adolescence, and they aren't really looking for them.
Thank you very much for that comment. Thanks, Cynthia.
Thanks, Lisa and Caitlin. We are giving 5 minutes for questions, and so for those questions that we weren't able to get to online today, we will be taking inventory of those and sending out a question and answer document in about a week. So please check the NRC for In-Home Services website for the unanswered questions for Caitlin and the Family Acceptance Program. What we are going to do is go ahead and move on. We want to have an opportunity to hear our parent advocate, Ellen James. And Ellen? Yes. With their LGBTQ youth, what is the first place I should send them for information?
Well, you could send them to our webpage, to the publications of the family education materials. We've got our generic materials up on the webpage now in English, Spanish, and Chinese, and they can download them. One of our family videos is up there. That really, I think, is a great place to start because it's totally tied to research, and it's based on you know, what we've learned over all of these 11 years, and it's not really rooted in opinion, which is something that I think troubles families because they hear so many opinions on what is the way to help their children. As I mentioned, we're also in the process of developing specific faith-based materials and materials at lower literacy levels. And we field test all of what we develop, so parents and caregivers actually give us guidance on what it should be like and how to talk about it and how to present it. Peer support is another really important place, and for families with gender nonconforming, gender variant, or kids they think may be transgender, Gender Spectrum is a great website to visit. They have a conference every year that's really fantastic, a national conference where families and children come to get support and information. And PFLAG is located all over the U.S. and has chapters. Some are more likely to have children and adolescents than others. And Ellen, I think, is a great resource on many of these issues because she's not only been through it, but as an advocate and as somebody who works on these issues professionally, she has many contacts, I think, to help families get accurate information.
Okay, thanks, Caitlin. Okay, I finally figured out the way to take Jennifer Fowler off of mute. Oh, I'm sorry, Jennifer Dressler from North Carolina off of mute. Jennifer, you can go ahead and ask your question, and sorry about the technical issue. Jennifer, your line is unmuted. Okay, well, it looks like somehow Jennifer is not ready to ask a question, so we can go ahead and move on. We have one other question is, have you sought support, counseling, et cetera, to help you with ideas around parenting your daughter, and were they helpful?
Actually, we've been through several counselors. The first counselor we were referred to by the pediatrician was at Boys Town, which is based in Omaha, and they were relatively helpful. They at least made it clear that it wasn't a self-fulfilling prophecy and that supporting gender expression wasn't going to exacerbate it or make it worse, and that the only thing that would happen if we didn't support her was damage to her psyche. So that was a great blessing that we got from them. It was the first place that I had heard the term gender identity disorder. The only thing I would say that wasn't helpful was they gave us an article and then sent us on our way, and we would have liked a little more guidance. It took us quite a while to find a counselor that specialized in gender issues, and I think that's really critical because there are counselors out there who are putting themselves out there as gender specialists, and they really don't have any specific training in order to adequately treat gender nonconforming and transgender children. And it's also important to understand that not all gender nonconforming children are going to be transgender or even LGBT. And so I think that's kind of been the focus really of my work, is just raising the awareness of gender nonconformity in general and how many children that affects. And if we focus there, we will be helping LGBT kiddos in the process, but we'll be helping all the other kiddos outside of that LGBT spectrum as well. And so then the next specialist that we went to actually has trained all over the world, and so we're grateful to have her here, but there are many communities around the country where that doesn't exist. So I think having somebody that's a reference point that can find help in your region is really critical, to reach out to some of these organizations like PFLAG or me, and I can go to somebody else and find somebody that's close to where you are so that it's somebody that's going to help them and not hurt them.
Great. Thank you so much, Ellen. I see that Jennifer Fowler has a question, and so Jennifer, I have taken you off of mute, and you should be able to ask your question now. Okay, well, it looks like for whatever reason, that feature is not working, so we will go ahead and move on, and if we're able to get either one of Jennifer's back on the line to ask those questions, we'll do that at the next segment. So we're going to go ahead and move on to the youth portion of our presentation, and this is where Cisco Cancel will go ahead and share some food for thought with us.
All right. Good afternoon, everyone. I have to say I'm really touched by Ellen's story and her and her daughter's journey. And I look at all this research and I think to myself, how great is it that we have this tangible material here. And I really get, I would say the main perspective that I have here is that it really gave me a slogan here, and it says, support is saving lives. And as I hear all this research, as I hear all these interventions and the power of these interventions, and I hear Ellen and her daughter's story, that's the number one thing that came to me, is that support is saving lives, and it's definitely continuing childhood. So I want to share a little bit about myself. My name is Cisco Cancel. I entered the foster care system at 11 months, and at the age of 9, I was adopted, and that became my permanent stable home. I re-entered foster care, unfortunately, after that adoption failed at 15, and I found myself being saved, let's say, by this intervention program that I was lucky enough to receive their services. When I came back into care, I had spent 2 prior years sort of homeless and not having a stable place to live at, and I was doing a lot of couch surfing. And so I was very defensive. I didn't know how to play a role of a son. I didn't know how to adapt to giving the authority back to an adult figure because of the fact that I had so much authority over my life. But it was this program that came in and did in-home therapy and was able to address some of the root problems and ask some of those hard questions like the discussion of sexuality and a million other things that we talked about that really made that placement work for me, because what I found out there was this pattern that continued to happen when I re-entered foster care of being able to live somewhere and then the home being disrupted for a variety of reasons. And I think that this program really keyed in on some root problems. It was the first time my foster mother had a young person, and then to have a teenager who was so strong-minded at the time and so defensive, it really was very helpful to have that mediator and those persons coming to the house to really talk to us. But what I really want to share with you today is the story about a friend of mine who he lives with his biological dad. Unfortunately, his mother died at a very young age when he was 11. And he identified as part of the sexual minority community. And when his dad found out, it wasn't really the most positive experience for him. His father was from Uganda, and he was he had very different views, let's just say. And he really wasn't able to accept himself for who he was. And they spent these 2 months not speaking to each other until a mentor came in, and he was that supportive service that reminds me of an agency like True Colors, who provide LGBT mentors. And this mentor was able to connect with that dad in such a way that you would have never believed that that dad had any issues accepting his son 6 months ago. The mentor really worked with the young person, his dad and the young person, by being a liaison, educating his dad on what this meant. And I think that was the biggest question for his dad. And when I asked his dad what was his biggest worry, and his biggest worry was that he loved his child and he did not understand how this would affect his child for the rest of his life. And so having that LGBT mentor who was able to be there for him and able to explain to his dad and be that liaison actually saved him from coming into the foster care system, because his dad was at the point where he felt like there should be some type of state intervention and that his child shouldn't live at home anymore. And I think that's very painful for my friends, because I could see him going down. I could see him being depressed. I could see him not performing well in school. And all this was affecting everything in his life. And as we know, high school is a very important time. And for this mentor to volunteer to step in and to be that liaison and to educate his father, it really, really, really helped him out, and it gave the father a new perspective. And I get kind of emotional towards the end of the story because his son told, my friend told me that there came one day where the mentor revealed to the dad, after they had become very good friends, that he too was part of the sexual minority community. And the father was so astonished because here's somebody with a master's degree, here's somebody who's really just been very successful, been a great mentor, has become such a great friend to him, and he did not realize that every person who's part of the sexual minority community does not fit into these stereotypes, and that there's this misconceived notion of what being part of that community means. And so he had this respect for that mentor, and since then, after that, he grabbed his son and he held his son and he told his son that, despite everything, I love you, and he was so sorry for the challenges that they had experienced, and that he wasn't as open in the beginning. And I think that this was a catastrophe that was avoided. I mean, his son now graduated with honors, graduated and went to UConn. He was in the National Honor Society. And I think that this really proves that support does save lives. And the work that we talked about today and stories that were shared today prove that. I'm going to pass it back.
All right, thank you so much, Sisto. I want to make sure that everyone has a way to be in contact with you as well. Sisto is here, with us today representing True Colors. As you heard in his bio, he wears many different hats. And but if you have any questions in regards to the True Colors program, their contact information is listed on the slide. So this gives us an opportunity to ask questions of Sisto and his experience or in his advocacy work. And I also want to just take a minute and let both Jennifers know that if, since I'm not able to unmute your phone for whatever reason, if you could please type in your question in the chat box, then we'll make sure to read that aloud and get your question answered. And we apologize about the technology, but as you all know, sometimes these webinars, have their own little technical kinks that we have to work out. So we apologize for that. But if you put your question into the chat box, we will go ahead and read your question aloud as soon as we get it. With that being said, I want to find, let's see if there's any other. It doesn't look to be any other questions. We'll wait for Jennifer Fowler or Jennifer Dresker to type their question into the box, and we'll go ahead and move forward with their questions when they do that. In the meantime, we can go ahead and just progress. And what we want to do is, let you all know about the issue brief that the In-Home Services project has put together. And JP will go ahead and give us some information about that. And as soon as he's done, hopefully we'll have a couple more questions and we'll be able to close out. Thank you. JP?
Thank you very much, Cynthia. So I would like to draw the attendees' attention to the image on the screen and introduce you to the issue brief on in-home services for families of LGBTQ youth through the National Resource Center for In-Home Services. The work was authored by Dr. Diane Elzy. She's a professor at social work at the State University of New York in Buffalo. And I wanted to say that it's not only a literature review, but it also consists of interviews with various programs around the United States and Canada that provide services to families with LGBTQ youth. It has a variety of different types of resources for different types of providers. The resource list contains program summaries, research articles, books, training curricula, practice guidelines, and videos to share with families and other practitioners. And I would especially like to draw your attention to the last few pages of the document that highlight some practice tips for practitioners. The tips address topics like self-education and awareness, working with family members, working with youth, and assessing the strengths of families. The brief can be found online at the National Resource Center for In-Home Services website, which is the same website that this webinar will be archived at. So when they advance that slide, you will see that website. And I will pass it back off to Cynthia.
Okay, great. Thank you so much, JP. We did have some questions that came in, and we're going to hopefully be able to get at least to 2 or 3 of them. This question is for Caitlin. Caitlin, it says, Caitlin, I recall you were hoping to release new resources for family this spring. What are they, and are they moving forward soon?
Well, we just released the best practices designation for suicide prevention on our family education tools, and next month we'll be releasing the first faith-based version of our family education materials, and we'll probably have some other family materials out by the end of the year. And as soon as we finish the discussion guide in English and Spanish, we can release the video Always My Son, which is actually part of our family intervention series, and that dovetails with our educational materials and overall family approach.
Okay, thank you, Caitlin. Our next question that comes in is, can service providers get a copy of the screening tool on your website, or do you have to have staff training?
We provide staff training for it. It includes a lot of issues, including critical issues related to confidentiality, asking about sexual orientation and gender identity, the whole rationale for administering the assessment screener with adolescents, scoring it, and then, of course, developing a brief intervention plan in collaboration with the adolescents. So we provide those trainings on site. Obviously, it's not something that we can do for 1 or 2 people, so we need to compile, a group needs to be compiled. We just did a training for one of the mental health agencies in one of the counties out here for a large number of mental health providers, and we've done it for other kinds of social service providers and medical providers.
Okay, great. Thank you so much, Caitlin. We have time for a couple more questions. The next question is, one of the principal challenges in our area is fear among agencies that might be able to provide more and better supports for youth and families. Do you have any ideas about reducing fear of board reaction?
I have some, and I think Ellen and Sixto will probably have some, as well as Lisa, too. First, the materials that we develop are put out by critical agencies. For example, the first resource that we published related to our research came from our participation in the Model Standards Project, which happened over a period of 3 years with experts from all over the country developing guidelines for care of LGBT youth and out-of-home care. And CWLA published that. That's up on our webpage and the web pages of the 2 other legal organizations that co-authored it. Having sponsorship by critical professional associations is really important. Our family education booklets, as I just mentioned, have now been certified by the National Best Practices Registry for Suicide Prevention as the first peer-reviewed documents of this kind for LGBT people. And again, I think the certification aspect, the fact that our work is empirically grounded, we're known entities, we're really putting forth guidelines and approaches that are based on evidence. They're not based on opinion. And I think one of the reasons we've been really careful to place ourselves squarely in the mainstream of professional practice and care, and not to give forth opinions, is that it makes it a lot easier for jurisdictions to use our work. I just got back from training in a rural community in farm worker and agricultural fields on our approach with a whole group of a coalition of about 15 churches, faith communities, medical society, et cetera, that created a coalition to bring us in and train across all of these systems. So I think grounding in not only evidence but in appropriate clinical care and practice makes it a lot easier. This is not somebody's opinion. These are real lives. Personally, I was on the scientific committee for the Institute of Medicine to do the big study on addressing health disparities. So I think, we really offer a perspective that's grounded and science-based and practice-based, and that I think is going to help jurisdictions where they're afraid, because pretty soon, as our practices become more disseminated, they're going to become liable for not providing appropriate care in terms of the expected standards of care.
Okay, great. Thank you so much, Caitlin. We have about 2 more minutes for questions, and I want to try to get to at least 1 or 2. So there is a question, how do you work with parents who have zero tolerance for youth gender expression due to the parents' religious beliefs, resulting in the youth leaving home?
Well, first we start where the parent is, and I think we're so used to counterpoint and everybody being squared off in their corners. That doesn't really work to engage families. We have to meet the parents, caregiver, family, foster parent, whoever they are, where they are, give them an opportunity to share their experiences, their frustration, their concern, the challenges of what's been going on from their perspective, build an alliance with them, and then begin to introduce the material from our research. When we work, and again, as I mentioned earlier, we see faith as a strength. We don't see it as our role to change people's beliefs, religious beliefs and practices, but because our work shows that decreasing these rejecting behaviors is going to decrease serious outcomes, such as death by suicide, this is quite shocking to families that think and are told by others, including by providers, that trying to change their children or punish them or shame them is going to help them. Actually, our research shows the opposite. We approach families in a respectful, non-judgmental, compassionate approach. We build an alliance with them. This is why actually some evangelical pastors are using our material, are consulting with us about how to work with families, and why we've been invited in by religiously conservative groups to train their clergy on how to support and counsel families. But the approach is absolutely critical. You have to come from a compassionate alliance-building frame, and again, our work is evidence-based, so it's not our opinion. It's really tied to very rigorous research conducted over a period of years.
Thank you, Caitlin. We have actually had several responses or comments that came in that really are very nice and very sweet, and I wanted to pass these along to Ellen and for them to be public. And they are thanking Ellen for sharing her story and her pictures. And we've received several of those comments, and just wanted to, thank you very much, Ellen, and also to Sisto for them sharing their very personal stories. We have time for 1 more question, or actually 2 more questions. I'm going to go ahead and pose those. I believe this one should be for Ellen. Is it? Oh, I'm sorry, maybe it's not for Ellen. It says, is it possible to organize a group here in Canada to access your screening tool and accompanying training online?
I would suggest that rather than waste the time of the panel, because this is valuable time, that they just write to us. If anybody's interested about this, just send us an email, and it may take us a while to get back to you because we're swamped right now, but we'll respond and we can communicate about this offline. I'm wondering, do Sixto or Ellen have any comments that they wanted to make that they didn't have time to make?
Okay. I'm sorry, go ahead, Sisto.
I'm sorry, I was just saying that I don't have no final comments besides support is saving lives, and it really does make the difference when we have support.
Ellen, do you have a last comment?
I just want to encourage everyone to go to the Family Acceptance Project website and check out the resources there. They are invaluable, and they are an amazing, amazing tool to help open hearts and minds. And that the documentary, Always My Son, I probably have seen it 50 times at least, and I still cry every single time. I have no idea how they got that into 15 minutes, but it is absolutely amazing, and it's extremely powerful, and it's wonderful that they're just available to anybody to download. It's a great, great asset to have.
Great. Thank you so much, Ellen. We're going to go ahead and move along, and Lisa's going to talk to you a little bit about the NRC for in-home services and how friends can also provide some additional support.
Thank you. And before I forget it, I want to mention also something that I'm not sure we included in our resource guide, but we will post a link to on our website, which is that the Administration on Children, Youth, and Families has published an information memorandum in April of 2011 on lesbian, gay, bisexual, transgender, and questioning youth in foster care. And it's a very helpful resource with guidance to states. So I suggest you look at that. Both the NRC for In-Home Services is a service of the Children's Bureau to provide training and technical assistance to states and federally recognized tribes. And we can accept requests for help, either information requests, or if you represent a state or tribal system and you'd like to have us consult with you about helping you find training resources or providing you technical assistance to work on issues related to improving services to families of LGBTQ youth. And just encourage you to check out our website, and you'll see the procedures for requesting assistance. And you can always just pick up the phone. If you are not a state or tribe but you want information, we are welcome your inquiries, and we'll do everything we can to assist you in getting to the right resources. Julie, would you like to talk a little bit about Friends?
Sure, I have to take myself off mute. Similar in terms of resources with for the CBCAP folks, and obviously you have opportunity on a regular basis to have communication with the TA coordinators, but or you can be emailing me in terms of potential resources. Also in the evaluation, you can provide us with information or ideas of things that you think would be helpful to have as potential resources going forward. So there's multiple ways to access, and let us know what you need. Thanks, Lisa.
You. You're welcome. Thank you. And today's webinar will be archived on the NRC for In-Home Services website, and here is our website information. Let's let that slide sit for a second. You can also just put NRC for In-Home Services into your Google browser, and you'll come up to us. I'd like to, while we're as we're closing, I'd like to thank Cynthia Peterson for her work on putting together the presentation, and I'd also like to thank Dr. Diane Elzy, who wrote our issue brief and who introduced us to the folks who've been able to help us present today. And in future webinars, we may be able to bring you some more presentations from the programs that we discovered that are doing this work around the country. So do let us know in your evaluation if you'd like a follow-up webinar. That'll help us think about how to proceed. Cynthia, any last comments? Okay, here's our contact information for both Julie and for both Friends and In-Home Services, and we'd be happy to work together for either on any of the groups that are with us today.
Great. Thank you so much, Lisa. I want to, on the behalf of the NRC for In-Home Services, we want to thank everyone for joining today's webinar. If you have additional questions, the contact information for each of the presenters were presented during the webinar, and you also have access to the handouts. And that information is listed for your convenience. So please feel free to reach out and ask your questions. Immediately following today's webinar, we will send out a short online survey and hope that you will take a moment to provide us your feedback. We hope that you learned something new today. We want to thank you and have a great afternoon. This concludes today's webinar. Thank you so much.